The Steps Hip Spica Care DVD is made for parents and carers of children in hip spica casts. They are a series of mini videos which cover aspects of looking after a child in a cast. The videos are examples of how real families coped with everyday tasks of looking after a child in a hip spica. They are not meant to be fully comprehensive and cannot tell you everything you will need to know about hip spica care, but hopefully they will reassure you that solutions can be found to many practical problems. Remember that it is best to contact your healthcare professional if you have a problem you cannot solve. Parents, carers and healthcare professionals have reviewed these videos.
So, next week I'm quite nervous about it, to be honest. Really how she's going to react and what she's going to be like when she actually comes out. She did very well last time, but her legs were very stiff and it took her quite some time to really get used to not having the plaster on. The fact that she's able to communicate with us this time hopefully will make life a little bit easier. But I am still worried about what she's going to be like. And it's really how long it's going to be before she's going to feel comfortable and we're going to feel comfortable. Because one of the things you always worry about is that they're not going to be able to do quite as much as they were just before they were in plaster. It's going to take time for those muscles and things to build up again. So I am quite nervous about how she's going to react, and if she wants to go doing the things that she was doing just before she went into plaster, it's going to take a few weeks to really get back into her stride. We're hoping that she won't need any physio and that she'll be able to do the physiotherapy herself. So that will be hopefully one less thing to have to go back and forth to the hospital for. The other thing, sort of on a personal level for her, is one thing I've noticed under the plaster is that her skin's got really quite dry, and I'm wondering what it's going to look like under the plaster. I've noticed when I've been washing her that especially the foot on the leg that's in the full length plaster has got very, very dry, and we've had to put some cream on that. And I can see, just feeling up the plaster as I'm checking it, that her skin's very flaky and she doesn't particularly like me touching that. So I am a little bit apprehensive as to whether there'll be some strange sensations for her once the plaster's taken off. And they quite often sort of talk about it being sort of like pins and needles on the skin. So I've been trying to talk to her about the fact that her legs might feel a bit funny when she comes out of plaster, and they might feel stiff, and it's going to take time for her to walk around and feel confident again. But we'll take each day one day at a time. On the day we have to go in, and they've got a policy at the hospital we are at, that they won't take the plaster off unless there's a bed available on the day, because some children can get quite distressed. So the policy is that they make sure that there's a bed available for us to go into. So we have to get there sort of early afternoon, and then when there's a bed available on the ward, we go to the ward. We're quickly clocked in by one of the junior doctors, and then we'll be taken down to the plaster room where she'll meet one of the technicians, and hopefully it will be one of the people she's met before, so it's a familiar face. And they'll take the plaster off, and we've been talking to her about how they're going to use this noisy saw, which looks a little bit like a hoover.
Johnny's going to take my plaster off.
How's he going to take it off?
With a special hoover. Just going to push bee, and they're going to go bee onto the fluffy bed. Onto the fluffy bed. But not here. Not down there.
No. And how she might feel herself shaking or vibrating, and I've been putting some baby toys which she's got which vibrate on her, just to really try and get that sensation across to her. And we've been playing about with the hoover to sort of try and talk to each other over the hoover, so that she knows that it would be difficult to speak to us and that she might need to shout, which she probably won't have any problems with. And what's the hoover going to, what's it going to sound like?
A bumblebee.
A bumblebee?
Yeah.
It's going to be very, very
noisy.
Noisy.
But I can shout.
Yes.
I can shout, Mummy! Mummy!
And she knows where they're going to make the cuts down the side of the plaster, again, so that she's not worried on the day about when they come towards her, and they don't need to explain. She knows what's going to happen. and she knows that they make these 2 cuts down the side and that they open the plaster out like a window and then they lift it off her. And she does know that it's going to feel a bit strange.
And what else is it going to do? Can you remember what else?
It's only easy because you open it up like a window and a door.
All right. Okay.
It's very easy.
And when the hoover goes down the side and it cuts your plaster, and what else? Do you think it might make a funny sort of feeling? Do you remember? It might make you sort of wobble a bit. It might make you vibrate like bzzz.
I like that. And what else?
So, I mean, we're hopeful that we'll only have to stay the 1 night. But the plan for most people is that they then go back to the ward after the plaster's been removed, and they've got a big bath on the ward. So they'll put her in the water and just get her up on her feet, which is obviously a lot easier than doing it just walking straight away. So they do that in the bath on the ward, and fingers crossed we'll be home the next morning. So once we've actually gone home after having the plaster taken off, I'm not 100% sure exactly what happens, but I'm sure that we'll see the consultant or one of his team before we get discharged. And then from what I understand, speaking to the specialist nurse, they see you about six weeks or so after the plaster's been removed, just to see how things are getting on. And at that stage, it's really an assessment to see how she's walking, etc. And if they're happy with how things are going, then we're just sort of followed up on a routine basis every few months. If they're not so happy with what progress she's making on walking, then it's at that stage that they would refer us to a physiotherapist. So if she wasn't mobilising as well as they'd expect for a child, sort of 6 weeks after coming out of plaster, then at that stage we'd get referred on and she'd have some more directed physiotherapy. But otherwise it's pretty much up to us. And we're encouraged to do things like take her swimming, because that's good for their legs, obviously.
So I think the important thing to recognise is that different hospitals have different ways of doing this, and that will be dependent on the hospital and also on the child itself. It might be that some children might need a general anaesthetic to have their plaster cut off. So the best person to contact would be the healthcare professionals who you're under. Remember to watch parts 2 and 3 to hear the rest of Bethan's story.